Welcome.
The Pathology Innovation Collaborative Community is a regulatory science initiative that aims to facilitate innovations in pathology, as well as advance safety and effectiveness evaluation. The PI Collaborative Community aims to harmonize approaches to speed delivery to patients through collaboration in the pre-competitive space. The PI-CC is open to all stakeholders, public or private, including but not limited to academia, industry, healthcare providers, patients, and advocacy groups. Meetings of this kind are an example of lawful activity under federal antitrust law, because the focus of the meeting is on government action or policy, including the industry's responses or positions taken with respect thereto. However, antitrust monitoring is needed for companies' own protection, since they are direct competitors meeting together. These meetings need to stay within protected subject matters and need to be monitored so that they do not stray off into inappropriate areas, such as pricing and price terms, sales and service territories for particular products, customers and customer territories, each company's individual decisions regarding selection of suppliers or customers, marketing plans and especially future marketing plans or new product offerings, other proprietary or competitively sensitive information. Today's meeting will follow the written agenda, and there will be no discussion of pricing or other prohibited topics. If the discussion veers into those topics, we will terminate the discussion. If you have any questions or concerns about the propriety of a discussion, please raise it immediately, and we will take a break to determine how best to proceed. The Medical Device Innovation Consortium acts as the formal convener, and we will follow their conflict of interest policy. For additional information, we defer to our Code of Conduct and our website, www.pathologyinnovationcc.org. We look forward to moving the field forward.
Perfect. Welcome. April 27th, 2022. Welcome to the steering committee of the Pathology Innovation Collaborative Community. Thanks everyone for taking the time. We have a pretty packed agenda, and as usual, all this material, including all the sources and links, etc., will be made available on the website, and antitrust monitoring applies, and welcome everyone. Let's get started, because there's a lot of updates. First of all, there was a Clinical Laboratory Improvement Advisory Committee, in short CLIAC, meeting happening on April 13th and 14th. There were a lot of agenda items that I think are noteworthy for this group. In case you missed the meeting, I think there's a recording, and Ulla will paste the link. You can also Google just CLIAC Advisory Committee Meeting 2022. You get to this agenda. The two quick things I want to point out is that some of the people who are active in the field in digital pathology submitted letters. Many of you did, so thank you. One of the topics that was under discussion is digital pathology, including remote diagnostics. Thanks everyone for providing input to what we called the CLIA waiver project. A big shout out to Joe Siren-Trappin, plus the leadership of the Association for Pathology Informatics. Numerous people have submitted comments and submissions. Here's an example. And on the specific website link we will provide, there's, I think, over 20 letters received on various topics. The two things I wanted to highlight was, on the one hand, Tim Stenzel from the FDA, the head of the section CDRH, which is the Center for Digital and Radiologic Health, if I'm not mistaken. He provided an FDA update.
You are mistaken, Joe.
What is it?
He's not the head of CDRH, is he? I'm sorry, I might be mistaken. You continue. I'm going to look it up.
Okay. Please. I don't want to say anything wrong, but in any case, he represented the FDA and provided an update, and there were many updates, including the COVID response, the emergency use authorization components. Just see Joe Siren-Trappin got on. Hi, Joe. I just gave a shout out to you. So big props for drafting the letter, your personal one as well as the API one regarding digital path. And quickly, Tim Stenzel provided also a quick overview of our collaborative communities, and mentioned that, because this is the CLIAC meeting related to a lot of laboratory tests, he pointed out that the Pathology Innovation Collaborative community is the one sort of axis related to pathology diagnostic tests. The other part that I wanted to mention from the agenda was that at one whole talk, so these are 20-minute talks, was reserved to Keith Kaplan. Don't know if he could make it to the call, but of course he's one of the key folks pushing for digital pathology, and he gave a beautiful presentation, Digital Pathology, the Past, Present, and Future. We took a couple of screenshots. I will reach out and try to get the whole presentation. It was a great overview from tele and robotic pathology all the way to what are some of the incentives, and we picked here a pathologist shortage slide, on all the different needs and national as well as international components, and he presented really a great overview over the various components. So again, we tried to provide the slide deck, but those were two clear presentations related to some shared interests here. I don't know if other people were on the CLIAC call and want to make some comments as well, but quickly opening it up.
Just wanted to ask for those that were on the call too, is that has the recommendation from the CLIAC come out yet? I was just hoping that, because they were going to summarize things, but my general impression of the tone was that they were going to move forward with recommending extending the enforcement discretion past the PHE. That would be the recommendation. I didn't hear any arguments throughout the entire meeting against that, but I haven't seen the official recommendation yet.
To my knowledge, let me just paste the link to this. So this is all the materials should be in the chat. I know that very often CLIAC acts in a way to defer back to prior recommendations that they did. And CLIAC has previously recommended that non-traditional workflows, that's the term, for example, similar to flow cytometry or next-gen sequencing. And in 2019, they mentioned that digital pathology would fall under the same umbrella, which is a non-traditional workflow, that they should be incentivized by appropriate means. They didn't specify, of course, the public health emergency in 2019, but that I think is very likely going to be the case, that they refer back to existing recommendations that already are incentivized. So CLIAC has never said that digital pathology shouldn't be implemented. So it is, it would be in line with all the letters and all the submissions that some of which are portrayed here, that CLIAC will hopefully recommend that. But to my knowledge, the official 2022 CLIAC recommendation hasn't been released.
Oh, I see. So it's actually for the entire, I thought they would do a summary of the meeting itself and say this is a recommendation. But I assume, I guess there's just one overall letter for the entire year. CLIAC recommends the CMS.
So what they have, if you look at the same link, past meetings, I can also paste that really quick. You will see that this is the prior meeting summaries. So I went all the way back to a few years, so till the 1 November 2019. You can see those meeting summaries, and they usually are concatenated and building upon one another.
I see.
Thanks for clarifying, Brandon. Yes, OHT7 in vitro diagnostics and radiologic health. Sorry about that. Of course, Jeff is the boss. Yeah, so I think the meeting was overall positively received. There's also patient representatives on there, so I think just sort of a shout out to everyone who provided input there and represented this, I think important and future field of pathology. So if there are more comments on that, or if the recommendations come out, of course we should and discuss. Usually, of course, until that is taken up through CLIA and or CMS, that ultimately defers to the executive branch of that section or center. A quick reminder, so the CLIA or CLIA waiver project is still up on the website. And if interested, if you want to contribute or if you have comments on that, please take a look. It's in the project section of our website. And if you're interested, please email. There's a few other updates that I think are probably of interest to many of you. First, as you know, the decision summary from Page Prostate, that's the first AI algorithm in digital path or AI pathology, was released. And there was a shared request by several of this community that we would do a session to go through the decision summary. Now that is a little bit tricky because that's a product, and generally speaking, we have to abstain from that. And we're in current discussion in collaboration with Page and the amazing regulatory team that they have, that they would give us an insight into how they approach this topic and really go through the decision summary, which I think is an incredible opportunity. We will coordinate with the FDA that this is not a product encouragement, but actually going through from a practical perspective, what does a decision summary look like and what can be gained in terms of insights from that decision summary, in terms of case numbers, in terms of, numbers needed, predictive properties, power estimation, statistics, and what are the different sections. So please look out. So this will definitely happen. So we have a preliminary okay, but we need to coordinate with the agency and with the, in this case, vendor to make this a neutral, more scientifically focused presentation. But I think for many of the, let's call it, lab developed test developers, etc., it would be great to have that insight. And I think it's from a regulatory science perspective, it is probably good to have that skill set of what does a decision summary look like. Next item is grant challenges. I know several of you have been on these calls. We put together a project where Francesco Ciampi and Roberto Salgado presented the idea that data sets from grant challenges could be used as tools for regulatory submissions and or help sort of the innovative technologies to move forward through regulation. If you haven't seen the website, it is already containing both recordings and it is not encouraging that this is happening, but a lot of points have been raised here. So please take a look if you haven't seen that. And this Monday was actually a brief follow-up discussion, I would say reaching the end of the known playing field where people were really saying like, how could we do this? So next steps are an actual grant challenge, one of the existing ones, to see whether we could make that a tool and what that would take in terms of next steps. I also want to point out that Brandon put together a very interesting slide on what's typically missed during some of these submissions, and I can briefly flash this here. So the core content of submissions for computer-aided diagnostic or aids in radiology, you will find this is a very, very useful slide. There won't be time right now in the steering committee to go through this, but the recording entails more detailed explanations on what that would probably mean. So if you're interested in that, please check out the Grant Challenges project site, and there will be a follow-up meeting coming up soon. One other quick update is that I know some of you were at AACR in New Orleans. I couldn't go, but maybe someone wants to briefly make some comments. I know, Kate, you had thumbs up. Do you want to briefly mention something and what was going on there?
It was a very, very, very large conference, so I was not able to attend everything, but Keith Wharton, also on the line, attended as well. So it's very nice to have a very mini PyCC meetup at the conference. And I was extremely surprised and kind of wished I had PyCC like business cards, given the number of times I was mentioning the collaborative community, because there was a large assortment of interest in digital pathology at the conference, way beyond what I had anticipated even going. So I look forward to seeing what AACR has in the future.
Keith, any comments? No? All good?
Overwhelming meeting. Great to be in person with a lot of human beings in 3 dimensions looking at posters. I wonder how much digital pathology is on the radar of AACR in general, since it's one of the words in their organization is research. And it's still a bit of the Wild West there. I don't know if they're thinking about translation of digital pathology products or modalities with most of the stakeholders of that meeting. Now, ASCO, I would hope, is a different story, but I don't know. That'll be interesting to see.
Actually, there was a companion meeting at USCAP, and I actually pulled it up. So I'll give you a kind of an idea from the pathology branch. Do you mind if I share, Joe, just real quick?
Ulla is the master.
Okay. Yeah, I'll just show the people like what the companion was. I don't think it was recorded, unfortunately. So let's see. Oh, can I share? Okay. Let me see. So there we go. Right there. So this was the companion meeting in LA, March 20th. And you can see this is the topics. So they're kind of in this multiplexing biomarker image analysis space. And then this one's kind of into 3D pathology. For those that are familiar, kind of new ways to image biopsies in line with some of the new technologies, OCT and Lightsheet and all this other stuff that's out there. But I think this is about as focused in pathology as I've seen AACR. I think this might be the first USCAP meeting they participate as a companion as well. So I'll just stop sharing.
Yeah, I think we get to this in a bit, but at ASCO, I think that is one of the things that we put on our to-do lists. We should definitely try to reach out to those folks. I think AACR is sort of the brain trust of every sort of, let's call it, cancer researcher. So I think that we reach a lot of people there, a lot of basic scientists, high complexity tests, etc., not afraid of touching new things. But at ASCO, I think that's really the large base of the practicing oncologists. And when it comes to actually touching patients, which I think digital pathology will do, I think that's, we get to this later. So I'm looking forward to some ideas.
So real quick comment. I just pasted in the chat, Deci Bio, which is sort of a research firm, put together a report on multiplexing, which of course is my interest, and digital pathology. I just pasted it in the chat for everybody.
Perfect.
To take a look at. It's pretty nice.
We worked with them to put sort of an overview of the spatial transcriptomics platforms together. I can probably share that also on the website. I don't have it right now, but cool. And then I see, Kate, you also mentioned a dedicated meeting touching on digital pathology. Yeah, that's great. All right, moving forward. So next slide here, let me just see if I can share this again. So this is, I think, a big check mark, and I hope that I be able to explain how impactful this is. So as a collaborative community, we can collaborate directly with the agency, i.e. The FDA. Now, through many attempts, and I don't know, Kate and Brandon knows how tricky this was, we now have a Teams channel directly for PyCC with the FDA for file exchange. Now that sounds like very simple when it comes to us collaborating outside of the government, but this is actually a big deal. So this will be a direct link to share data back and forth. And, again, there's antitrust rules and, certain confidentiality agreements that have to be put in place. But this is a confirmed channel to actually enable information exchange. And this can be done for research projects, for regulatory science projects, and for also, getting feedback on certain things. So in practical terms, and I know, I will go to this. So some of these elements that we aim or can actually are delivering, we have basically now a way to exchange information that is not using the usual channel of a formal submission. And for those who have been involved, you probably understand what an incredible opportunity this is. So high five to, Brandon, Kate, and all your teams on the other side of the virtual wall. I think that's a great thing. So if you have your virtual applause button ready, please make plenty use of it, because this will be really helpful.
First, Joe, the credit goes to Jitesh at MDIC.
Oh,
I
absolutely.
tried and it failed. Like everybody who tried to use it got blocked at some point. So
It's, we couldn't do it without MDIC, of course, and Jitesh. I don't know if he made it to the call today. They're very busy these days because they're planning several events over the early summer. But I think this absolute great teamwork. For the next bullet point, and we put this here under this channel, is that this will also mean that our projects, as you know, and I know many of you have contributed in so many ways, that MDIC has requested that we put a larger interactive Gantt chart together. And before we get to what that would entail, I have to say, Ulla is amazing with web development, and I'm trying my very best to keep up with what's going on. But we're looking for help, and I know some of you are probably great web developers. So if someone, this is basically a call for assistance from the steering committee, from our membership. If someone has web development skills for interactive Gantt charts or could connect us with someone, that would be amazing, because that would be great to consider those skills for this one project, so that we can link this back up. And Ulla has all the knowledge about all the various interactive threads of this very complex web page. I don't know if you have recently checked it, but we have a great online resource, but that would be a call for help. So if you have or know of someone, if you could just shoot Ulla a quick message, it would be great to get that. Quickly, we got several new members. I don't know the exact member number, Ulla, but maybe you can put that in the chat later. But I just wanted to briefly outline what the current mode of organization is, and where we stand and why this request was made. So, the web URL has changed. So we have pathologyinnovationcc.org now, and pathologyyalliance.org still maps back to this, so you can use both. And our projects, if you want to call them project, or the project organization, falls into 3 big groups. One is presentations. So the decision summary I just mentioned will become a presentation. Then we have projects, which are smaller in scope and very concrete. So for example, Joe has a great idea about, federated IDs, and we make that a project, and you can solicit input from many people, and here are some individual concrete practical deliverables, and those are existing. And then larger things are put together in working groups. So putting this together in a Gantt chart is not easy. But just for those who are new in this group, and I just see nearly 600 subscribers to our updates, so that's great. We do not build competitive products, and we do not actively participate in a project, but provide a platform for multi-stakeholder input. So if you haven't seen this is sort of like our main scope. And the value proposition of that is to, of course, have all these things here in one-stop shop. But the reason why we need to provide sort of a tangible milestone chart, if you want to call a Gantt chart that, is that, this is kind of like fading out a bit in terms of what is our current status. So this is the official mission given by the FDA, Michelle Tarver's shop, on what is a high-level outcome for implementing collaborative communities and the performance management system for that. These, the step that we build an action plan and that we have performance measurements, that's fine. We communicate progress, you're just witnessing that, and however, to adjusting that and making sure that the various stakeholders' perspectives are represented. I think we're sort of in this stage here. So somewhere between, that we know what we want, that we built it, that we have an action plan, and now we're sort of in this realm. So that's certainly pushing sort of the envelope forward, but I just wanted to mention that. So that's, again, just a quick shout out in case someone has web development skills for interactive Gantt charts. That would be amazing. Next stop here in our packed agenda is patient advocacy. So we reached out to many patient advocacy groups. Currently we have, I think, 3, if not 4 member organizations. And one element that I think, Ulla, if you could share that in the chat as well, is that, you know, our first patient advocacy group, Friends of Cancer Research, just released the annual report for 2021. It's pretty packed, and if you're not familiar with Friends, please take a look. It's quite impressive, the amount and complexity of projects related to diagnostics. I just throw out comprehensive genomic profiling, tumor mutational burden, homologous recombination deficiency, cell-free DNA testing, and we're collectively trying to push them towards digital pathology, and they're carefully scoping this out. I think they're excellent positioned, and you know, I'm very glad and thankful for all their support. I just wanted to give a brief shout out, so we hope to see more of them. In terms of other collaborations, some of you may remember APIA. This is the Anatomic Pathology Patient Interest Association. They're a patient interest group, and in several discussions at USCAP, I was presenting sort of the scope and vision of PyCC to them. They have preliminarily agreed that they would also join the PyCC charter by signing it. And they have, as a collaborative project, proposed a protocol development for assessing pre-analytical variability. So they recognize that, you know, fixation time, fixation state is very key for diagnostic accuracy. So the next meeting with APIA representatives is pending. If someone's interested in that, pre-analytic variability, very likely in the prostate space, because they're also, of course, interested in AI and use. So please just drop Ulla a line. We will happily invite you. And then one other patient interest group, this Sepsis Alliance, we will also have a follow-up meeting. So the one element to just quickly point out, this is of course different from other patient initiatives, that it's a multi-system disease. And you know, from an FDA or regulatory perspective, tying things to multi-system diseases for specific regulatory pathways falls somewhere in between common diseases and orphan diseases, where a certain not too infrequent but complex topic has to be covered differently. So we were asked to help with setting up a collaborative community related to specifically sepsis. So that was just sort of a follow-up on patient advocacy collaborations. In case you know someone from a patient advocacy group who you think may like what we do and or wants to contribute, please provide this as, you know, a contact. All right, we have a brief outside the box component, and this came actually from the EMA, and I will, you know, show you quickly a guideline that was co-developed between a harmonizations group, ICH, and the European Medicines Agency. So this is the, it's somewhat out of the box, and I wanted to set the stage briefly so that, you know, this, I know I'm talking mostly to people in the diagnostic space, but this guideline is actually for drug development. But I learned something very, very interested, and, you know, 3 people that are on the call were present, and I just wanted to share this quickly. So this is a guideline that's intended for analytical procedure development, but in the drug development space. So in other words, when you develop drugs or when you manufacture drugs, there are intricate processes that are control mechanisms or real-time release control mechanisms that test, for example, whether your compounds are pure. This is part of good manufacturing practices. But what these tests are effectively analytical tools to assess whether a drug compound is pure. So you could consider this analytical component that's happening in the manufacturing process an analytical test. Now, while that doesn't sound the same, right? Diagnostic approvals and drug approvals are completely separate. What I thought was very, very interesting is looking through this guideline, which is currently drafted, is the following section. And I wanted to just provide this sort of as a context. where they say that in certain cases an established analytical procedure, so just call that, let's say, diagnostic test for now, can be applied to multiple products with little or no modification of measurement conditions. For new application of such a platform, analytical procedures, the subsequent development can be abbreviated and certain validation tests can be omitted based on the science and risk-based justification. So if you apply that to digital pathology, an analytical procedure can be easily refactored to other, in this case, measurement conditions, or, I don't know, in the appropriate ways it would probably be intended uses. And I just wanted to share this as an approach because this document, and I think Ulla just shared it in the chat, includes change modifications, includes all the ISO standards, and includes control strategies that are weighed by attribute changes. So while we think that in the diagnostic space, change control with continuous learning AI requires a complete new setup, when I was in this call, I noticed that this risk-based assessment and the knowledge related to these changes is actually well established in the analytical performance field when it comes to drug manufacturing controls. So I know that this is very, very complex and it's a bit outside the box. But if you have the passion and interest in this, take a look at this document. And it's, again, this is, I think the comment period, the deadline for comments is till July 2022. So if you work in a biopharma company, and I know some on the call are, I know Roche is very interested in this, and change modification regarding drug manufacturing can optimize and save a lot. Questions about that or comments?
Said a comment. If it comes to fruition, let's say after comments, nobody has any objections, it'd be nice to actually write a paper that translates that to the pathology molecular space. This is more general, but translating the guidelines for vendors in our space would be pretty helpful, as well as regulatory.
Yeah, so absolutely. I proposed something akin to that immediately, and I said, hey, this is exactly what we need. It's like, if you replace some of these words with the more diagnostic terms, this is exactly what we practice every day, right? If you get a gastric biopsy, you would be applying the same technology. And then the question is this functioning the same? Well, I would say that subsequent development can be abbreviated and certain validation tests can be omitted. Yeah, yes. So some of these paradigms, I think, fully apply. Sorry, if you look at what they call the analytical procedure life cycle, again, you have to translate the lexicon a bit. This would be the diagnostics or diagnostic assay life cycle. A lot of these things are actually identical, and the concepts are existing, and they're trying to harmonize this now in the drug manufacturing space because, of course, control strategies and product releases are incredibly intricate, but you want to optimize, keep manufacturing costs down without putting patients at risk or, in any case. So I just wanted to share this, and sort of this risk and knowledge matrix that they're proposing is just genius. Like, Joe, great idea to write a comparison or, bridging.
It's a Rosetta Stone, translating this general speak into something that all of us can relate to, because we see it, using the language of whatever we do, digital pathology, surgical pathology, you name it, whichever analytics we have.
And I think the Rosetta Stone project sounds phenomenal. You just gave it the project name. Love it. Like it. All right. In the same line, and I know that this comes also a little bit, as a curveball, but there was a recent guidance document, which sounds a bit strange, but that's for products between a drug and a device. And, that may sound a bit bizarre, but in the ophthalmology field, if you have eyedroppers, for example, the vial that contains the drug is a device, but it contains a drug. And for this specific setting, there's a specific guidance document now released. So you see this here. I think we have a copy of that as well. Again, this is outside the box, but if you follow sort of the Rosetta Stone logic, there's a lot of things that can be learned from these specific use cases. So please take a look. I don't want to hold up a lot of time because I want to leave some time for broader discussion. A quick overview over 5 amazing papers that we have received, and there were actually 10, but we just had to like figure out what the best were. One is from Nirmal et al., which is a spatial landscape of immunoediting in primary melanoma. As you can tell, this is a series of workflow steps that delineates the immunoediting, and the analytical complexity of their papers is really impressive, so please take a look. The second, this is from the Gary Nolan group, always like very comprehensive studies. In this case, they provide tissue schematics, in this case of germinal center, where they decompose the entire tissue schematic and reconstruct it using sort of spatial analyses. Extremely impressive work. If you haven't seen it, take a quick look. This paper here from Dr. Vasudevan is I don't know if you haven't seen this. This is definitely for anyone interested in sort of bridging one domain with another. The paper is called Digital Biomarkers, Convergence of Digital Health Technologies and Biomarkers, where they provide in 3 pages kind of like a complete paradigm shift of what a typical best is, biomarker definition framework, what for diagnostic biomarkers and monitoring biomarkers, what the digital biomarker equivalent would be. Take a look. It's mind-blowing how concise this is written, and I think the pre-publication is out now. One paper that I find also great from a title by Dr. Moses and Pachter is the spatial transcriptomics field. I know many of you have seen this. Provides a historic and sort of a technology overview on coupling digital, or in this case, slide microscopy histology with digital and next-gen sequencing in terms of spatially resolved next-gen sequencing as something where the spatial information and transcriptomics are coupled. I know many of you work on this. I think this is a great overview work in case you're not familiar with it. And then, of course, one paper here that you've probably all seen in the press. This is, the Nurk et al. 331. This year, the complete sequence of the human genome that in part delineated that certain areas are much more complicated than, the former linear idea of the genome. So these were just sort of 4 or 5 quick papers of some other many amazing things. So please keep sending. If you have a paper, sending it to us. We're happy to feature it and disseminate it, because if it has relevance to pathology and innovation, please do so. In part by some of the trainees, we were asked to put common resources out there, and we started this. And I wanted to briefly outline why and how. So the 4 resources that are commonly used, and one is more like how to visualize data, how to do machine learning with Python, etc. And we reached out to several of the authors, and I wanted to show you these 4 elements here that come from basically visualizing, machine learning, more the context of how to be a good clinician in the future, and then some payer-related things, how to get reimbursement. And these are actually freely available, and it's fantastic resources. So the first one is a Python machine learning guide, where they show an example of a code strip, show what the visualization looks like, and show common errors. And it's basically a self-teaching course where you can go through kind of like a role-playing manual where you say, if you encounter this, go to this page. And it's really phenomenal, and it's literal code snippets explaining it at like high school level. So I learned a lot. I have a very hard time working with Stack Overflow, because usually I copy and paste for 2 hours. Eventually it works, but I don't know how. In case you feel like that, take a look at this. Second part is this Clinician of the Future report. This is an international survey across many countries, and a part in there that I recommend specifically is chapter 3. It's called The Future Tech Savvy Clinician, where they, based on survey results, international breakout by country, what a clinical team of the future will look like. It entails much more support staff. It entails a more generalized doctor versus a more, or one should call them hospitalist. And I know, in Michigan, the AP hospitalist is a big thing right now. But then there are specialists and how to integrate this. So if you haven't seen this, please take a look. It's actually quite impressive how far they go. The payer context here, I'm very thankful for Bruce Quinn. He's one of the key top leads when it comes to reimbursement and payer strategies. And he has written this beautiful piece April 2022 about cancer patients and access to molecular diagnostics. There's a whole section, interestingly, here, again, chapter 3, the coding and reimbursement for comprehensive genomic profiling and tumor mutational burden. This is probably the most cutting edge technology that now did receive reimbursement. So again, kind of cross-walking this over, what can we learn from that for digital pathology? And if you have the time to read through this, it's an excellent read, very dense, but also extremely clear. And then last but not least, this is from Nicolas Rougier. This is HAL. I don't know if you know the movie or the computer in the movie, the Odyssey. I don't know if that was intentional or not, but this is a guide to how to use Python and Matplotlib. That's one of the specific libraries which is in this landscape of Python-specific visualization softwares, again, with very concrete things, how to get amazing graphs done. If you haven't seen this, this is also sort of a self-instruction manual. So to follow the concrete suggestions, these are the 4 resources that we host now. If you have time or interest in that, it would be great to disseminate that and as additional resources for the things we do. Finally, and then we open it up for discussion and new topics. A few things to announce. First, if you haven't seen this, the PI Summit, formerly API Summit in Pittsburgh, May 9th through 12th. We have a few dates and times where we're going to get together. Ulla, I forgot, Tuesday and Wednesday, right, evening. So far at an undisclosed location, but we will disseminate that with the group in case you're here. And then we have a talk by Renato and Jacob from Dana-Farber here on Monday, June 6th, about PathML, which is an open source software toolkit for computational pathology research. Very happy to have them present about this. So this is a specific event for PyCC. So if you have time at this hour, again, they will explain the capabilities of their open source software and their toolkits, and it would be great. I don't know if they're on the call, but I'm very thankful for organizing this, and we will be happy to host that. I just see the question about how to register. Ulla, do we have that up on the website yet, or?
Yep, you don't need to register, but there is a calendar event add link on the website at that link I just added.
Perfect. You're one step ahead, always. Yeah, so ASCO, I think you may have seen the early registration ends. At the same time, what we discussed earlier, should we have is someone going to ASCO? Could we have like a mini event there? I don't know if some of the vendors will be there that are on here, but
They're on Monday, I think.
Yeah.
After the talk.
So maybe if you could just drop a note to Ulla, then we rally everyone who goes there, and then we find either a location or just to A, hang out, B, network, and then, sort of disseminate the word. But I think ASCO is definitely sort of a place that we should go. I know Friends is usually there. I know several of the industry representatives have, booths there, etc. So should be a good event. All right, let's open it up for questions and other topics by announcing our next meeting, which is May 25th. And yeah, so I hope we have at least 10-15 minutes time for new topics and discussions. Kingsley, how are you?
I'm doing good.
I had the pleasure of seeing.
Call me.
I know. I saw you live.
Yeah.
Gio, how are
that was
you?
interesting.
Good. Wonderful.
Yeah. Any new topics?
How about there is a conference coming on next, well, two conferences next month that I'm planning to attend, and we may wanna think if we wanna make it kind of official representation, or not official, semi-official. One is the conference in Europe, the European Society, and I'm just tagging along with the CAP delegation that they have. They have a block of speakers, including Marilyn, Bui, and Neil. I don't know if Joe is there. Are you going to Europe, Joe?
This is in Berlin.
Berlin, yeah. Are you going to?
I don't think I can make it, but I forgot the dates. I think someone asked me, and I.
It's the same week of the other conference that I was going to mention, so I think it's around the middle of June, but I don't remember. That's the European Society of Digital and Integrative Pathology. And again, I'm tying along with the DPA, so I would like to, if I can, I will make it unofficially, make some notes and bring them to the group for a debrief when I come back. And I think that's a no-brainer. You know, it's a good society to keep a relationship with. The other one is the SEAM, the Society of...
Gio, give me 1 second. So Berlin, Frank, I have to call you out now. He stayed awake very long because he's one of the key folks in Berlin. Frank, hey.
Yeah, but sorry, I'm not a pathologist, so I'm not going to attend some of these meetings.
Got it.
And if you want to have any detailed information, that I'm probably the completely wrong person for that. I'm sorry. But if you need information, I might get them somewhere else. So if you want to.
No, absolutely. I think Frederick Clauschen is like organizing this, right?
Probably he is also one of the chairmen there, so I could imagine.
So, sorry for calling you out, but you know, since you are in Berlin, I had to. Sorry.
Yeah.
Gio, second.
Close.
You can take me on a tour of Berlin. We can go.
Why
around.
not? Yeah. Well, if you like to ride the bike, just give it.
True networking.
Just drop me a note.
And what was the second Congress, Gio?
Oh, the second is just a few days before, or the week before, is the SEAM, the Society for Imaging Informatics in Medicine. Is this kind of a spin-off of the College of American Radiology? And what they're doing is they kind of came out of radiology. I don't think a lot of you are familiar with them. And they are inviting other societies that use images in diagnosis to make it more inclusive, and also they have vendors. So they have been reaching out to pathology, and there is a delegation to going that again includes Anil and Marilyn, and I'm gonna tag along too. Oh, Toby Cornish is on that one, and so they have reserved this kind of, it's an afternoon. The whole afternoon is pathology topics. So I was kind of a late comer to that, so I'm not involved in speaking unless somebody gets sick or something, and I can take over last minute, but I will be there too. And the good thing about it is that, you know, we've always been interested in doing kind of having some advice from these radiology people who've been ahead of the game. And I managed to get into the steering committee of this because of the pathology situation and also in the membership committee. And I was talking to this person that they have developed these models for a long time and they call them the maturity models. And those kind of assess, it's like a self-quiz that any institution does to determine if they are ready to deploy any of the informatics digital imaging workflows. And I volunteered to help them with a pathology model. So honestly, I don't know what I'm doing, but I will ask for help when the work comes along. So they will help us to create this maturity model, which I don't think any of the other institutions, the DPA or the CAP are currently working on. So that may be something of use to us.
I think that sounds great. I mean, there's multiple questions embedded in there. First, you should and freely feel free to always represent PyCC. I mean, there's no formal roles other than that we're aiming to network. So whoever wants more input from multiple stakeholders for these questions, please feel free to assume that role. Anyone and everyone. I think that's sort of the power here. And then to the question about radiology, I know we had Bib Allen from ACR. I know Brandon is very active in that domain. And I think any other project or any other input, feel free to do that. That sounds amazing. I mean, we could make it a project, we could make it a talk, an event. Again, feel free to throw over whatever you think we could help with in organizing, and we rally people. So. I think you're muted.
I don't know how did I do that. Did you do it? Somebody muted? Okay. I was saying that I'm going to include in the chat the information for this other conference. The one is in Orlando. The one from the SIIM, SIIM. I'm going to send information now. And if somebody wants to be there or happen to be there, it'll be nice to have more people representing us. Again, this is a very good move from the radiology people to include pathology, to give us a whole afternoon of talks. They're inviting also ophthalmology, cardiology, gastroenterology, all these ologies that have images to collaborate in different projects.
So I see Xavi on the line. I was at the ASIP meeting a few weeks ago in Philadelphia. Great meeting, very eclectic, very investigative pathology focused, obviously based on its name. But Xavi gave a really nice, his last talk in a session on AI and computational pathobiology applications, challenges in the road ahead. I don't know, is there going to be any summaries available for that, or anything that could be shared? Because I saw the last bit of it. The session I was in was actually competing with it, but you gave a really nice talk on a lot of the eclectic issues, societal issues with AI and adoption.
Thank you, Keith. There are not really any other updates. I did share my slides with you, upon
with me, yes, but that was just with me, because I asked nicely. I said please, but I'm not going to share them with anybody.
Yeah, I mean, I'm happy to share it with the group if it would be of any value. I do have an upcoming talk on the same, or on the topic of AI in pathology at Genentech. So I think that may be probably more suitable for this audience. So yeah, I have yet to start working on that though. But thank you for your words of support.
Brandon, other news from you?
Yeah, I think there is an automatic mute button going on here. Just getting ready for Pathology Informatics. We got slides that are actually being cut for the project. So, I mean, images, I'm preparing a box account in a spot for their upload. We're really close to getting slides that we can then prepare for our pivotal study in the HTT project. But other than that, you know, felt like I talked too much on Monday and gave away all my good secrets. So if you weren't there, don't listen to the video because that's where all the secrets are.
That's a best product tease ever, you know, and it's free.
No, but you know, I totally see grand challenges as an oyster waiting to be cracked. And what we talked about is really how could those grand challenges be prepared more comprehensively to support a regulatory submission. And one of the things I said out loud is public databases have been used in regulatory submissions, so don't think that that's forbidden. So that's a bullet to share here. And of course, the key is that it's well characterized and you know, the right population, or at least a supportive population. We take all data that supports a submission, and but you know, whether it carries the day depends on how much information about that data you can get. That's my worthwhile sharing here to ease on the other one. But otherwise, digital pathology is very active, I would have to say.
Just pasted the link to the video. Second video, you know, session 2 discussion, go to 4006 and you get all the secrets.
I'll give one other little teaser. On my device advice wiki page that just really points to FDA guidance documents and presentations. I recently uploaded a training I gave to my regulatory review colleagues. So that's, you know, content that we as reviewers see as important to share among us. And I got those slides cleared. I hope to do some narration so that it's in video form, but it's about reader studies. Reader studies are those studies where you would use the digital pathology image without the computational pathology model, and you would use it with the computational model, and then you would compare the performance across those two arms. And that's one of the regular performance assessments that we ask for algorithms that are helping the pathologist. You know, well, show us that it helps the pathologist by doing the data without the algorithm and doing the data with the algorithm. So that slide deck is about MRMC studies is the buzzword that I use for studies that have multiple readers and multiple pages, MRMC. And that's actually the talk I gave at MGH a year ago. That's how golden it was. It's still got legs, and the division director in the radiology group asked me to post them and asked for a video so that she could point sponsors and manufacturers to it. So, not to toot my own work, but it is, you know, I have been working hard. About 10 years, at least 10 years of effort in that slide deck.
It is definitely extremely informative, also from a, you know, practical perspective. Probably with, you know, Sarah's paper, those two things are amazing. I can't find the device advice link right now, but we can share that on the website, and know that Sarah's paper is on the resource page on the PyCC website already. All right, we're at the top of the hour. Thank you everyone for joining and taking the time. We email around all the materials and the link to this meeting, and I hope to see you next month.
Thank you, Joe.
Thank you.
Thank you, everybody.